Hello, everyone, and thank you for joining us on today's webinar, where we'll be diving behind the science behind our COVID-19 response resources that we've provided to date. My name is Reena Agarwal, and I'm the Chief Operating Officer at the Center for Active Design. The Center for Active Design has a long-standing history of translating complex public health literature into actionable strategies for the real estate industry. We have basically spent the past decade advising communities, corporations, and jurisdictions on how they can ensure that health is a priority within the investment, design, and development of their real estate portfolios. And now, as the operator of the Fitwel Certification Systems, we provide a compendium of science-based tools and resources for a variety of property types. The scorecards we provide include office properties, retail developments, multifamily residential buildings, as well as commercial and residential sites. With the global spread of COVID, we have seen a heightened awareness from the industry on the importance of our vision of building health for all. We've seen a massive uptick in interest from our community to understand what can be done within buildings to mitigate both acute and long-term health risks. We've heard loud and clear from our partners and Fitwel users that you all wanted us to do what we do best by once again translating the available literature into next steps on what the real estate industry should prioritize to mitigate transmission of viral diseases. So today, I am thrilled to be joined by two experts from the Center for Active Design. In addition to myself, you'll hear from Joanna, President and CEO of the Center for Active Design, and Sara Karerat, Senior Associate at the Center for Active Design. Sara has been leading the effort on our COVID response materials and has been responsible for staying abreast of historical and new literature available related to viral diseases and COVID-19. So based on the demand, questions, and interest that we've seen from the industry, we are providing 5 chapters, as you now see outlined on this slide. Now note that we normally would not put out resources in kind of a piecemeal format, but given the questions that we're receiving and recognizing that many companies are currently developing pandemic response plans, tenant reintegration plans, we wanted to provide you with insights that you need to show you what the science is saying as quickly as possible. So the chapters that we developed were based on the review of thousands of public health research articles. We constantly re-reviewed the literature to apply learnings from other viral diseases, including things that we've seen, including SARS and influenza, while also staying up to date on new research, which speaks to the unique aspects of COVID-19. We also make sure to stay in regular conversation with our partners at the CDC, who help guide our framing and point us in the right direction towards new and relevant findings, again, related to the unique aspects of COVID-19. The first 2 chapters are the focus of this webinar, with chapter 1 focusing on what we know to date about how COVID-19 is being translated, and accordingly, what can be done, what can be prioritized within buildings to lessen the risk of transmission. Chapter 2 is on building trust within the tenants of commercial office buildings. We offer literature and strategies on how building owners can help their tenants feel safe and confident, because we know they'll eventually be coming back into buildings, and we want to make sure that they're able to in a safe way, which ultimately has a critical impact on their mental health. Chapter 3, which was released earlier this week, speaks to how building owners can foster positive mental health in residential buildings. Especially as folks are spending more and more time in residential buildings, we want to take a critical eye at that mental health focus. There are 2 more forthcoming chapters, with chapter 4 focusing on how we can refocus and optimize cities for people. This chapter is really a response to some of the more recent articles that we've seen printed that have taken a bit of a negative slant on density within cities. In this chapter, we'll refocus the conversation on how density can support long-term and short-term public health goals. And finally, chapter 5 will look at the intersection of chronic diseases, equity, and COVID-19. We'll shine a spotlight on the actionable steps that we have to foster in order to provide equitable solutions for all communities, regardless of their background or income level. Now, a common theme that you'll see throughout each of these chapters is on risk mitigation. Our perspective is that it'll be pretty impossible for buildings to guarantee a completely COVID-free environment. Rather, what we recommend is that building owners and employers focus on what they can do in buildings to reduce risk of transmission, while also fostering positive mental health. And finally, note that we'll be updating these chapters in the coming months based on the questions we receive, the feedback we get from you, along with new literature that is published related to COVID-19. So this is an ongoing process that we'll continue to stay abreast of to continue to provide the resource that you need as new information is coming out. So just a couple quick admin items before I turn it over to Sara. Reminder that we will be doing a Q&A at the end of the session. So please send all your questions through the Q&A function that can be found at the bottom of your screen. If you're having any technical issues, feel free to use the chat button. We have staff from our side who will help you navigate that process. And also note that during the Q&A at the end, we'll turn our videos on so that you can see our team and have more of a one-on-one conversation with us. So with that brief background, I will turn it over to Sara Karerat to dig into the science behind mitigating viral transmission within buildings.
Thank you, Reena. As Reena mentioned, the first chapter of our COVID-19 resource focuses on how we can leverage buildings to mitigate viral transmission. This chapter highlights immediate, actionable, and evidence-based solutions for addressing viral transmission within buildings, both commercial and residential. The goal here is to help guide building owners, facility managers, and employers as they work through either supporting residents in the present or as they plan for an imminent or eventual return to the office, depending on where they are located and what phase of reopening you all are in. While buildings are just one part of the fight against COVID and can never truly be fully virus-free, they do play a valuable role in mitigating risk of transmission, as Reena mentioned. The goal of this resource is to provide actors in the real estate industry with information to guide and support changes being made in response to COVID-19. We really want to use these resources as a way to cut through the noise, of which there is a lot right now, to bring you all clear and factual information supported by the research. And now I'm going to dig into some of the details found within Chapter 1. So as you can see from this graphic, there are 3 potential sources of COVID-19 transmission. The first one is person-to-person transmission. This type of transmission occurs through what are known as large respiratory droplets. These droplets carrying the virus can be released when an infected individual who's either asymptomatic or symptomatic coughs, speaks, sings, sneezes, or even breathes hard. For example, in an exercise class. This is believed to be the leading cause of transmission, is person-to-person transmission. There are a number of strategies that can be applied to mitigate this type of transmission. The first one that I want to briefly touch on is paid sick leave, which Joanna will be discussing more later on in the webinar. But just to tease a little bit, as you would expect, when employees feel empowered to stay home when feeling sick, that can make a huge, huge difference when it comes to mitigating viral transmission. The 2 strategies that you have likely been hearing the most about are social distancing, which we like to refer to as physical distancing, and hand washing. Physical distancing is vital when it comes to diminishing the risk of viral transmission. Within residential spaces, this can be applied in a number of different ways. Building managers can post signage advising that only people living together should take the elevator together, or that physical distance must be maintained within residential common spaces. Within the workplace, staggered work schedules and support of remote work for those who are able will be vital. Another strategy that you have likely been hearing a lot about is hand washing. Hand washing is really vital for a number of different reasons when it comes to reducing viral transmission. It may sound simple, but by washing your hands for 20 seconds regularly, especially after coughing, sneezing, or wiping your nose, you can help prevent the spread of the virus from yourself to someone else. This is true even if you are asymptomatic, as we know a significant proportion of those with COVID are. As always, it is also important to wash your hands after using a restroom, which is surprisingly not common practice. While we still have more to learn about whether COVID-19 can be transmitted via urine and stool, RNA from the SARS-CoV-2 virus has been detected in stool samples. One study found that of those observed, less than 6% of the sample washed their hands properly using soap and water for 20 seconds. So there's definitely a large opportunity for improvement here. One strategy that we've been advocating for years now is hand washing signage. Hand washing signage that cites the benefits of hand washing and the potential positive health outcomes associated can be especially impactful when it comes to encouraging proper hand hygiene. The next form of transmission that I want to talk about today is surface-to-person transmission. This pathway occurs when a person touches a surface where large droplets of the virus have landed and then proceeds to touch their mouth, nose, or eyes. As you can see in this image, there are several factors that impact the survival of the virus on a surface. which is also referred to as a fomite. A fomite is basically a fancy word for any object where the virus can be carried. It could be a door handle, a sink faucet, a desk, or a countertop. This is why you hear so frequently about the importance of cleaning high-touch surfaces. That's because the opportunity for one of these objects or fomites to carry this virus is accelerated the more frequently it's touched. The virus's survival on one of these surfaces depends on several factors. First, it depends on the virus properties, which is something we are still continuing to learn about when it comes to COVID-19. It is also dependent on the properties of the fomite or surface. This is also an area that is incredibly interesting and is continuing to be explored in relation to COVID. A recent study published in the New England Journal of Medicine did begin to explain the different lifespans of the virus depending on the surface. This study found that the virus can remain viable for up to 72 hours on plastics, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. It is very important to note that just because the virus is viable on the surface for that long, that does not mean that there is enough of the virus to cause an infection, something called a viral infectious dose. By the end of these time periods, only 0.1% of the starting virus remained alive. Basically, this means that the virus is steadily dying over time, meaning the viral concentration is steadily decreasing. While it's possible to become infected from the surface, it becomes increasingly unlikely over time. The third factor impacting the lifespan of the virus on a fomite is the surrounding environment. For example, what is the humidity level? Is there UV exposure? The exact impact these elements have on COVID-19 is still TBD, but we are continuing to follow the research as we learn more. When it comes to reducing risk of surface-to-person transmission, the key strategies are regular cleaning, maintaining good hand hygiene, and creating an environment where relative humidity is between 40 and 60%. Regular disinfection is one of the most evidence-based and concrete ways to reduce risk of surface-to-person transmission. The COVID-19 virus can be deactivated by common disinfectants. It is especially important to target, as I mentioned before, the high-touch areas such as tables, doorknobs, light switches, countertops, faucets, and sinks. One especially interesting tidbit is that a cleaner sink can even increase the likelihood of occupants washing their hands. So cleaning here is really a win-win. We also wanted to note that no disinfectants are green seal certified because none are completely harmless given their purpose of killing viruses. That said, we recommend incorporating guidelines for safe use of these products into any cleaning protocols. Within the chapter, which you can find at fitwel.org/COVID-19, we've linked to guidance from GreenSill, which provides very thorough information on how to safely use disinfectants, which we recommend you check out. As for humidity, the reason that it can be leveraged to mitigate transmission is that environments with low humidity are more supportive of viruses. The droplets that I talked about before that are released through sneezing, coughing, etc., in dry air evaporate quickly, which means they reduce in size and are able to travel further, hit more people, and also reach more surfaces. By ensuring humidity is between 40 and 60%, buildings can help decrease the number of surfaces a droplet reaches. While we know that humidity is effective at reducing the length of time virus particles remain viable, there are also serious health concerns that must be considered when increasing humidity within a space. This is especially true for older buildings, which oftentimes weren't built or designed to support higher humidity rates. Humidity should be regulated by property managers and building owners, and we do not recommend personal humidifiers within commercial buildings as that can disrupt overall humidity levels. The third and final type of transmission that I want to talk about is aerosol transmission, which is an area we are continuing to learn more about as new research is emerging daily. Aerosol transmission of a virus occurs when small droplets that you see in this image travel further than 1 meter through the air, hence the physical distancing guidelines that we've all grown to become very familiar with. Long-range airborne transmission is possible when the droplets of infectious materials are small enough to remain airborne and be transmitted over long distances. Research on the extent to which COVID-19 can be transmitted via aerosols is currently inconclusive. And at this time, Despite it being inconclusive, in an effort to mitigate risks, the WHO does recommend taking precautions aimed at reducing aerosol transmission as we continue to learn more about the virus. Recent evidence indicates that aerosol transmission may be possible, especially within highly trafficked areas. One study found airborne SARS-CoV-2 viruses, which is the virus that causes COVID-19, in highly trafficked and unventilated spaces, including patient bathrooms and medical staff areas. In addition, I wanted to touch on a very recent study released just this week that found that fitness dance classes across 12 sports facilities were connected with 112 infections, 54 of which were among students that were taking the class. The article argues that the intense spread was likely caused by a mix of factors, some tied to person-to-person transmission and others potentially unknown, tied to aerosol transmission. In addition to the large class sizes, the warm atmosphere in the sports facility mixed with turbulent airflow caused by intense physical exercise is known to cause more dense transmission of droplets. So the mix of this situation together created a very prime area for the virus to be transmitted. So as you see from this example, there are multiple factors that need to be considered, and it's never just one factor that's causing the transmission. In addition to the strategies that can mitigate person-to-person transmission, aerosol transmission can be mitigated through ventilation and filtration practices. Higher ventilation rates have been shown to be associated with decreased viral transmission. One study found that ventilation rates of up to 25 liters per second per person were associated with reduced prevalence of communicable respiratory infections. Just as a caveat, this study was not in relation to COVID, but rather other respiratory infections that are better understood at this time. Basically, long story short, bringing in more outdoor air has a strong potential of reducing aerosol transmission. Air filtration is another effective approach to mitigate viral transmission within aerosols, as well as promote high-quality indoor air. One study found that the use of MERV 13 filters were associated with a 31% to 47% lower transmission rate than a similar space without any filtration. This is an example where the filtration pretty much went from 0 to 60. So comparing zero filtration to a MERV 13 filtration, which can trap between 75% of air particles that are between 0.03 and 1 microns from nothing. In addition, air filtration is important for improving general indoor air quality and reducing exposure to particulate matter. Long-term exposure to particulate matter has been associated with increased risk of mortality among COVID-19 patients. So these efforts will likely support health in both the short term as well as the long term. Now I just want to take a couple of minutes to address a couple of frequently asked questions related to steps building owners and facility managers can take to mitigate viral transmission. The first question that we've been hearing a lot is around UV lights. We have a lot of our partners asking us if UV lights are effective at killing COVID-19 on surfaces, and are they safe to use? So this is an area we're continuing to learn more about in relation to COVID-19. What we do know is that UV light has long been known to kill viruses. That said, there have also been concerns about its detrimental impact on human health. UV light has been shown to effectively kill the COVID-19, the SARS-CoV-2, which is the virus that causes COVID-19 within laboratory settings. And those tests were on stainless steel and N95 masks. So two very different surfaces. There were different times for how much UV light was needed in order to kill the virus on this surface, but we have seen the success. What we've learned through research is that UVC light is the safest option. Emerging evidence has shown that low doses of far UVC light are effective when it comes to killing viruses and are also not harmful to humans. Just this week, the MTA, New York City's public transportation system, announced that they will be testing the use of UVC light to clean trains. This is the same technology currently used in hospitals to support disinfection efforts. The UVC light being used by the MTA is not safe to be used around humans, and there can't be humans in the trains because of the frequency that is being used. That said, a lower frequency, there's potential for it to be a safer option. All of that said, within many settings, regular disinfection is likely sufficient as long as rigorous cleaning protocols are implemented. This is an area that we're continuing to follow, and we'll update our resources as we learn more. The second and last question I want to talk about before turning over to Joanna is about wearing masks. Can wearing a mask decrease risk of COVID-19 transmission? The short answer to this is yes. That said, as with everything, we're continuing to learn more as additional research emerges. Universal and near universal use of masks has been shown by models to reduce transmission by preventing spread from an infected individual to another person. Mask wearing can also help us all refrain from touching our face, which, as we all have likely learned, is exceedingly difficult. The modeling that has been done suggests that if 80% of the population were to wear masks that are moderately effective, so 50% effective, up to 40% of the projected deaths could be avoided in New York State. That said, studies indicate that the benefits of wearing masks is most effective when combined with other measures such as social physical distancing. In addition, much of the research demonstrating an association between wearing masks and reduced transmission relies on mathematical models rather than real life studies. That doesn't make them inaccurate, it's just a different way of studying the potential impact. Based on the emerging evidence base, masks should be worn in community settings, but should also be combined with other practices that have been proven impactful, such as hand washing and sterilization of high-touch surfaces. So with that, I would like to turn it over to Joanna, who is going to talk us through Chapter 2, Building Trust in the Workplace.
Thank you so much, Sarah and Reena. I just want to respond to a couple of chats, just so you guys know. We are not providing slides because all of this information is within the publication. So everybody, you guys don't need to take notes or try to, kind of glean all of this information. All of this is within the publication. You can download the first two chapters we're talking about today at fitwel.org/COVID-19. They're free to download. You can follow along today, or obviously you can read it afterwards. So all of this information is in there, which is why we didn't do a lot of slides. We thought it better to speak to the content. So yeah, just so you guys know. Great, so I'm going to talk about building trust in the workplace. And I think, it's fantastic, and thank you, Sarah, for going through all of the strategies that really look at what you can do. I think it's obviously essential that building owners, building operators, designers, facility managers actually have the strategies at hand and know the evidence behind mitigating the transmission of disease, of viruses, and of COVID-19 specifically. But what we have seen from countries and from regions that are starting to invite people to come back to work and come back into public spaces is that if you don't have trust in those building managers or in the building operators or whomever is in control of those spaces, you are highly unlikely to return to those spaces willingly. So it's really important that we both look at, yes, mitigating viral transmission, but also building trust. And there are actually many things that our built environment and visual cues and messaging tell us about whether we do or do not trust people, certainly people in power, whether they're controlling a building, whether they're your employers, or whether they are your government as a whole. So we're going to kind of unpack the evidence base as it relates to how visual cues and how communication actually impact levels of trust, either build it or erode it. So if we go to the next slide, I just want to start by kind of talking about mental health generally and what aspect of mental health trust plays into. And just to understand that trust and mental health are inextricably linked. And I think what's important to understand is an event, a pandemic, an emergency such as COVID-19 is actually having a really detrimental impact on our overall mental health. So globally, our mental health was already trending in the wrong direction. So of the 3 leading causes of preventable death in the world, social isolation was one of those top 3s, along with smoking and physical inactivity. And that is before COVID-19. So social isolation is a major risk factor, certainly for mental health disorders, but also for all aspects of our quality of life and life expectancy. And we have just, you know, all of us, many of us, gone through many, many weeks now of social isolation. And particularly vulnerable populations, the older populations and the youngest populations were already very vulnerable to social isolation. And obviously those have now been exacerbated during COVID-19. So social isolation is something that was already a big deal. We actually cover a lot of that in the latest chapter that we've put out, chapter 3, which is looking at how to support optimum mental health in residential environments. Another piece that really plays into trust and our overall mental health is really looking at stress and worry and the kind of underlying anxiety as well associated with negative mental health consequences. And I think just to reiterate what Sara said about this work being ongoing and the evidence base really continuing to grow over time, when we put out chapter 2, the study that we're referencing about the increased worry and stress related to COVID-19, you can see here that it was at 45%. This is when we put out the publication. So 45% of adults feel that they are worrying and stressing specifically related to COVID-19. What we have seen in the weeks since we put this publication out, this chapter out, is that this study has actually been repeated, and by the end of April, so the 45% number was from the beginning of April, by the end of April, that number had gone up to 56%. So 56% of adults by the end of April were worrying and stressed specifically around COVID-19. So our stress levels are certainly elevated. And then the other side of that equation on the trust piece is that we already don't really have high levels of confidence in people who are in power. So you can see here that only 66% of the world's population don't have confidence in current leaderships. And then as that relates to business, 51% of people don't trust or have confidence in CEOs, so on the business side as well. So we're already suffering from a crisis of trust and one of growing mental health issues. So this is something that was already an issue before COVID-19. The number one contributing factor to disability in the world, according to the WHO, is actually depression, with anxiety coming in at number 6. So these were already major issues around our public health, and obviously, as we keep saying, have been exacerbated by the additional stress and anxiety and social isolation that COVID-19 and the response to it has brought on. So what can you do as building owners to really look at this and to really look at how do I create an environment that is going to support the trust between me as the building operator or building owner and the individuals that are in the building? One of the big issues that we see with all of the strategies that we just talked about, that as an individual in a building, you are actually not aware of what the cleaning protocols are. You as an individual in a building probably don't know what the filtration levels are in that building. And it's very hard for you to find that information. So there's a disconnect between the people who are operating the buildings and putting in those strategies to mitigate viral transmission and the individuals who are in the buildings. And so this is one of the key areas that building trust focuses on. How do you communicate effectively all of the things that you are doing in order to support and promote the health of the individuals in a building, whether it's in a residential setting, a commercial setting, or a retail setting? So communication is going to be key going forward. And we don't just communicate with our words. It's also really important to communicate with actions and show the building occupants that you are actually enacting those cleaning protocols. So the cleaning protocols are very important also for building trust. So with building trust, it is important not just to have a clean space, but it's also important that you don't have signs of disorder elsewhere in the building. So if you have plants or in the lobby that are poorly maintained or built, or trees, you can see here that there's actually a negative impact on levels of trust. And this is from original research that we did with UC Berkeley, looking at trust generally. This is pre-COVID-19. But what we understand is that signs of disorder, so trash, litter, dust bunnies in the stairwell, plants that are dying, any of these things are actually going to erode trust. So even if you have like the cleanest bathroom in the world and you're following all of those strategies to mitigate transmission of viruses, if you have signs of disorder somewhere else in the building, if you have a leaky pipe, if there's a disconnect between what you're saying and what people are seeing, it is going to erode trust. So it is really important that as building owners, as building managers, as those folks who are kind of creating our built environments and maintaining them, we understand this has to be a holistic approach that looks at all aspects of how we design and maintain the spaces in order to promote optimum mental health. So that's really important. So having good communication plan, transparency, consistency, you need really high levels of specificity in your plan, and you need to engage both your tenants and your staff in that planning process in order to create an emergency preparedness plan that you can communicate, and that is something that is taking into consideration not just your perspective as the building owner, but also looking at the perspective of your tenants, because they bring a different perspective, they have a different set of priorities and needs, and they in turn, we would encourage that tenants in buildings are reaching out to their individual employees, and that is the kind of the fourth strategy. So surveying your individual employees to find out what they value, what they need to see in order to trust you and feel safe coming back into that environment. Safety and security, perceptions of safety are just as important when it comes to trust as actual safety. So perceptions of safety are certainly enhanced if people feel like they are part of the process, that their voice is being heard in this process. So very important that you're really engaging with all of the people who are interacting with your building. From whichever perspective you are. If you're an individual, you need to be talking to your employer or your building owner about the things that they're doing, and vice versa in both different directions. This is an example from one of our Fitwel champions, ChioVest. They've put together a really comprehensive preparedness plan, and it's really looking at tenants' needs. It's looking at, how do you prepare your own staff so that they are another way of communicating, so they are aware of all of the aspects you're putting into place in order to protect people's health and optimize the building around general health, not just specific to mitigating viral transmission, but they are your front line. They are the people who are going to communicate to people in the buildings. So very important that they are aware of the overarching goals of your plan and also the specificity of how you're doing that. So these are all very important when it comes to building trust. Just kind of touching on a couple of things that are in the frequently asked questions section. So Sara mentioned paid sick leave. So paid sick leave is in our building trust section because it certainly is a way to communicate that you as an employer are really valuing the health of your employees, whether they're building staff or whether it's a tenant or whether it's an individual building, an individual employer. So paid sick leave is an important tool when it comes to trust, but it's also a very important tool when it comes to actually reducing the number of people who are being infected in any kind of given scenario. So one study found that universal paid sick leave actually reduced the amount of workplace infections by 5.68%, which is a pretty high level actually. So it's a pretty simple thing to do, and one that I think is part of a much larger conversation about how do we really value health and how do we make health a primary focus of business policy. So paid sick leave is certainly something that we will be advocating for and really looking at the increase in research specific to this pandemic. And there's already relatively sufficient body of research looking at it from previous health emergencies. Another piece that we've had a lot of questions about is fever screening. So a lot of businesses, a lot of states in the US are now requiring fever screening. And we wanted to kind of give you more insight into the evidence base behind fever screening. It's important to know that the technology of fever screening is considered a valid technology. So it is actually effective at detecting if someone has a fever. The only time that you see a kind of an issue with fever screening if someone's coming in from an outdoor environment that's very hot and they're carrying hot air on their surface of their skin, that can lead to a false reading of a fever, but generally it's an effective tool. However, where there is a big however is that with COVID-19, as I think we all know now, that there are very high levels of people with COVID-19 who are asymptomatic the entire time that they have the virus. And then there are a lot of people who, although they may develop some symptoms, a temperature is not one of those symptoms. And so, of course, you can only detect fever screening, you can only detect a temperature, which is not an effective, not a highly effective way of actually detecting people with the virus itself. So what we're cautioning with building owners is that using fever screening can be part of a comprehensive approach to how you are addressing COVID-19 within your buildings. However, it must not be presented as a panacea. At no point should building owners say, you know, we have eliminated the risk of COVID-19 because we have fever screening. In fact, you can't say that about any of these strategies. As we've said already, this is about mitigating risk. This is about mitigating viral transmission. This is not about eliminating viral transmission or eliminating risk. That is not possible. So very important that fever screening be presented as part of a holistic vision, and that if you are going to use fever screening, that you have policies and procedures in place that look at what if somebody has a fever. How are you going to handle that? What are the secondary policies you have in place for looking after that person, dealing with it if it's in a public space, if it's in a retail environment? You know, what are your plans to actually address someone who has tested positive for a fever? Also, of course, as we all know, you can have a fever for a lot of other reasons other than COVID-19. So you kind of really need to understand the consequences of fever screening and be prepared to meet those consequences. So I think fever screening is something, it was used effectively with SARS, but SARS was a very different virus and actually presented very quickly with a fever. And so it had a higher rate of effectiveness against SARS than it will have against COVID-19 because of the actual specific nature of this virus. And of course, there's so much, like we've said all along, that we don't know about COVID-19 specifically. But those are two of the frequently asked questions we have talked about for building trust. And with that, I'm going to pass it over to Reena, who is going to talk about how all of these are actually addressed by Fitwel. Thank you.
Great, thanks, Joanna. So hopefully by now, there's an industry recognition that we take a science-based and data-based approach to all of our work, and this is certainly true with how we, developed and continue to develop the Fitwel standard alongside our federal government partners. So as you can see here, we hope that Fitwel is, and we believe that Fitwel is a pertinent tool for you in supporting your acute measures that you're hoping to take to mitigate viral transmission, but also support long-term health goals by reducing the risk of longer-term issues such as chronic disease health risks. The slide you see here provides an overview of the strategies that we feel the strategies that are currently in the Fitwel standard that align with the research and science that was presented today. Many of these strategies have dual purposes, so there's co-benefits to them in that they not only help to mitigate viral transmission, but they also help to reduce long-term health risks related to chronic disease. So I'll point out a couple of strategies. The one that we get a lot of questions around is the air quality strategy. Even prior to COVID, air pollution was the 5th leading risk factor associated with death globally. So in 2015, that accounted for 42 million deaths. Similarly with COVID, recent data suggests that high pollution levels were a cofactor, or are a cofactor in COVID-related mortality rates. So, there's a co-benefit to having a sound air quality policy, and then of course following that up with testing and data to ensure that that air quality policy is doing its job. As you heard earlier, hand washing is one of the critical prevention methods that we're seeing with COVID, more so than other viruses. Hand washing signs, also, it's a behavioral design strategy, so signage in general, whether they be stair prompts, informational signage or hand washing signage, tends to support increased positive behavior. So in this case, it's increased positive behavior towards hand washing, where hand washing is not relatively common. So this is an example that a hand washing sign from Tishman Spire, one that they put up to kind of educate people on how hand washing reduces the spread of germs. So, just know that our team is here for you and we're able to support you in your needs. So if, as you are looking to get people back in buildings and help your tenants feel confident getting back into buildings, please feel free to reach out to our team on the science or research you heard today, to talk to any of us about the Fitwel strategies and how they may apply to your properties now and in the future. So with that, I'd love to turn it over to the Q&A portion of the presentation, as we've had many questions come in. And Joanna, thank you for reminding me. I'm going to remind myself and ask Sara to turn on her video as well. If I haven't met you before, it's great. I'm hopeful to meet you in the future. And so I'd like to introduce Sara, Karerat, and Joanna Frank as well. So I'll kick us off with a couple of questions that I've seen come through. So one is that, Fitwel has always taken a strong lean on promoting the use of water fountains within buildings, and that's really to promote access to fresh drinking water over other kind of non-nutritious beverages. So what is the stance on water fountains these days, given that, we heard about surface to person potential transmission? We've heard some companies that are kind of taking away or removing access to water fountains. Sara, can you provide an overview as far as what you're hearing from the CDC, or perhaps what the current and new literature is saying?
Yeah, definitely. So this is a question that we've reached out to the CDC with, and at this time, they do not have a specific recommendation around shutting down water fountains. We want to sort of still continue to encourage access to water, as it has huge health impacts. What they would stress is that regular cleaning and disinfection, of sort of following along with the concept of cleaning high touch surfaces, is extremely important. The virus that causes COVID-19, so that's SARS-CoV-2, has not been detected in drinking water. So there's not a concern there of it sort of being transmitted through the water itself. Most of the concern would be with just the sanitation and making sure that the water fountain itself isn't becoming a fomite or a source of transmission. So using common cleaning practices will address those concerns. So we would continue to recommend increasing and maintaining access to those water fountains.
Great, yeah, thanks, Sara. And I guess aligned with that, I have seen a couple of questions related to green cleaning products. And I wonder if you can speak to the efficacy around the success of those green cleaning products in actually killing this virus. And we've heard from some property managers that are vying for perhaps non-green cleaning products because they feel like they're stronger and maybe more successful in killing this virus. Is that actually true? Have you seen that in the literature?
Yeah, so the literature on this, as when it comes to what the CDC is recommending, they point us towards a list of EPA-approved disinfectants. Sort of as I talked about earlier, disinfectants are just in their nature not completely harmless. That said, there are ones that are less harmful than others. According to Green Seal, that has a lot of really great resources in relation to this topic. Cleaning disinfectants that include hydrogen peroxide or citric acid or lactic acid or ethanol tend to be safer within this space to kill the virus quickly. When it comes to hand washing, soap and water, totally fine. It kills it. On certain surfaces, more kind of thorough disinfectant products may be necessary in order to kill the virus quickly.
Got it. And I'll ask one last question for Sara, and then love to hear from Joanna as well. And this is related to food service practices. So, we have a lot of current Fitwel users that are commercial office owners, where they provide on-site access to buffet-style food. Should any of those practices be changed? Is there literature which speaks to food surface preparation and kind of safety protocols that should be put in place?
Great. So this is another question that we were able to get CDC's guidance on. At this time, they advise that it may be necessary to refrain from family-style, buffet-style service because of risks of fomite transmission there. Again, it's not related to the food preparation itself. It really has to do with those surfaces. and that surface to person transmission. So at this time, they advise that serving individually wrapped meals is preferred to the family style service.
Great. So all the questions are for Sara, as is always the way in our office too. So another question, and I know that you mentioned it, but I guess it bears repeating. And we have a question about the actual level of outdoor air, the increased ventilation rates. I think you mentioned it earlier. Is that something that you can find again, or shall I?
Yeah, so again, it really does depend on the space. How many people are using the space? All of this is contextual, specifically with the HVAC systems, because older buildings, we understand, might not be able to handle as high ventilation rates, and we want to manage the sustainability with health. Because they are just interrelated. What I can say is that the study that I referenced had a 25 liter per second per person, and that was proven effective. ASHRAE recommends around 7 air changes per hour. There are different recommendations for different sizes of space. And on the extreme side, isolation rooms in hospitals have 12 air changes per hour. So that isn't going to be necessary for an office building or a residential space, but that's sort of the extreme side. What we do know is that more outdoor air is better when it comes to diluting any contaminants, viruses, particulate matter that's within the indoor space.
Fantastic. I have another question. This could be for either of you. So Thomas is asking which of the strategies that we're talking about for offices are applicable to remote home office environments, and do we have recommendations on that? And I know the answer is yes. So I know any one of us could answer this question. So who would like to?
I'm happy to kick us off. So, you know, as you can see, the three of us are all in kind of makeshift home workspaces right now. And what we've seen strong, loud and clear in the literature, I would say, is two things. One is biophilia and the second is daylight. We just came across a study last week which showed when somebody is in a stressful situation, their cortisol levels increase, and just 30 minutes of gardening is enough to get those stress levels down to baseline. So again, it speaks to greenery and biophilia and just visibility to outdoor space. So, you know, we promote within our staff and our employees that access to daylight and access to biophilia. So those are, you know, quick and easy solutions, I would say, as we are in this kind of shift from home to like makeshift workplace.
Yeah, and I'd like to add to that. I think the mental health piece, let's just talk about that. So we are putting out, the next chapter that we've just put out is actually specifically about mental health and residential environments. So again, download that, it's available right now. And it has a whole bunch of strategies. What you'll see immediately, and I think what's interesting, is that there are so many aspects of our built environment that affect our mental health. So yes, it's access to green space, it's access to nature, it's being able to see what time of day it is, getting sunshine. The access to sunshine actually, or daylight, actually increases your likelihood of having good sleep patterns, which is an essential part of all aspects of your health. So all of these things are interlinked. Air quality that we've been just talking about a lot about the office space, and obviously those are mechanical systems. Opening your window is a really good way of having an air change. So kind of just knowing that something as simple as that is still effective in a home environment. Not forgetting that sitting all the time is actually really bad for you, everybody, even though we're all doing it, staring at these screens. So increasing and ensuring that you are standing, and in addition to that, actually getting enough physical activity to remain healthy. I think one of the things that we've seen with COVID-19, and it's something we all knew, but it's just been highlighted with this, is that underlying health conditions will really play a significant factor in how severely you may be affected if you are to contract COVID-19 or any illness. We see it again and again in any kind of scenario. So looking at how to mitigate the risk of chronic disease, so diabetes, heart disease, obesity, is still incredibly important. It's always going to be important. 89% of the people who are dying in our home city of New York City have an underlying comorbidity. So understanding that the underlying health of the population and of the individual is going to have a big impact on how severely ill that person becomes. It's not the only factor, of course, but it's really important that we look at this holistically, and that's why the next chapters will really be looking at other aspects of holistic health. So just to kind of, it's all matters, it's all important. And now I haven't been doing a good job of answering my questions. Sarah, do you want to keep going on that, or I can ask more questions?
One thing that I would just stress, again, is indoor air quality. I think it's something that we don't always think about as much within our home settings, but now that we're spending so much time indoors and in our home spaces, things like making sure that dwelling units have operable windows, like being able to get that outdoor air into these spaces becomes really important as we spend so much time. And then also cleaning. I know that when the cleaning is up to us, it kind of can change things. So making sure to really prioritize cleaning of the space, as that can impact not only transmission, but also just the air quality within your space.
And I want to thank everyone for their questions, and we'll go through some more questions as we have time. But you'll notice that a couple of the questions that were asked at the beginning, we were able to kind of refer back to kind of CDC guidance. So we have been getting questions from all of you basically since this pandemic started, and then increasingly over the weeks. And what we're doing is that we rely on you to understand, you know, what your needs are. As Reena said at the beginning, one of the reasons we put this book out in chapters was because we were hearing the urgency with which decisions needed to be made by building owners, by building managers, and really kind of what is the evidence base? What do we know today? Understanding that this is going to continue to change. So we really do value the questions that you ask us. We value your perspective because it really helps us shape like kind of what area should we be focusing on, what should we be prioritizing based on the decisions that you are making, whether it's on the design side, whether it's on the facility management side, whether it's on the operational side. So very important to us that we continue to hear from you all as we do. And you can ask us questions specific to COVID-19, and we can answer those directly sometimes if the evidence base is to hand, and we can also then go out and field those questions to our partners in science and the CDC. So just important to kind of understand the process, and we can kind of talk a little bit more about the process going forward as well, because this is the first iteration of this publication. It is not the end of the process. So maybe we can talk a little bit about that, Reena, while I gather some more questions.
Sure. So currently we're strategizing, you know, we've gotten questions on, will the Fitwel standard change? Will it morph to reflect the new science that's coming out? I'll say, you know, right now our core focus is responding to your needs, which really what we're hearing from companies across the board is help us understand what we need to do to get people safely back into buildings. So once that's right for a particular community, what's our role as a building owner manager? So currently we're staying at the pulse of current science that's available. And like I said before, re-reviewing literature from other viral diseases to understand and to provide you those resources as is applicable. So we'll, you know, for the next couple of months, continue to learn from you and hear from you on your needs, and then strategize on how to best move forward with integrating these strategies within the Fitwel standard. And I will say, like I said before, most of these items are currently covered within the current Fitwel standards, so air quality, hand washing, emergency response plans, which includes a pandemic response plan, but it might be morphed depending on how we understand COVID is acting and how buildings can, again, mitigate that risk of transmission.
Great. So we have a question about mass transit, which is a shameless way of me introducing chapter 4, which isn't out yet, but we'll actually be looking at how do we optimize our dense environments for people. So do we want to just give a little teaser about chapter 4 about that? Sarah, do you want to?
Yeah, so I think what we've learned in sort of the research, I mean, this goes back to sort of the core of Center for Active Design and Fitwel, is that dense environments by their very nature are not bad. It's about optimizing them for human health. So what we found with mass transit is that, number one, it is an extreme benefit for the environment. The carbon footprint within urban areas is lower per capita than in suburban areas. One of the driving is one of the leading causes of air pollution. So we have a lot of good information in that chapter on those specific stats. And then also one thing that we're sort of seeing is that there's a real need to expand the mass transit system to provide additional options. So biking, making sure that there's infrastructure in place for bikeable communities. Same with walkable communities, trying to optimize that density to provide a variety of different options.
Great, fantastic. So lots of folks are asking for like kind of the evidence base in the literature. So I'll just say it's in the chapters, guys. They're all fully cited. If you flip to the last page, you'll see a ridiculous number of research papers that have been cited. And you're very welcome to reach out to us as well. Like if there's some specific area, we had a lot of questions about UV light that have come in very recently. Before that, we had a lot of questions about fever screening. So we keep responding to kind of what it is that you need. So I see questions here. I'm not going to answer them specifically, but kind of indoor air quality, fully cited in the viral transmission chapter, mitigating viral transmission chapter. So we're putting this resource out. We're putting it out as quickly as we are able, and as the evidence base continues to evolve. And so just know that we will update it, and we will put out information if major new studies come out, especially if specific to COVID-19, and they add to our understanding. Because at the moment, obviously, as we mentioned, for viral mitigation specifically, we're really looking at research that was primarily done on SARS or MERS or influenza. So most of the research is looking at other viruses, and only the new research is looking at COVID-19 specifically. I would say on the mental health piece, on the trust piece, and the density piece, this is all an evidence base that is much more established. And although the actual instance of COVID-19 has obviously created more risk factors around mental health, the actual response and underlying ways that we optimize environments to promote mental health, that evidence base is much better understood. So I think that the rapid evolution of evidence base is going to be around the viral mitigation chapter, and less so about the subsequent chapters. So I think, would you agree, Sara?
Yep.
Fantastic. Great. For next steps, Reena, do you want to just wrap us up? Thank you, everybody.
Sure. So just a reminder, in the 1 minute we have left, please reach out to us with further questions, feedback, other responses that you'd like. We are looking at those, and it is helping us understand how to respond to you and the needs that you have. Our email that we've created is covid19@fitwel.org. You can also go to our website at fitwel.org/COVID-19 to download any of the resources that we've discussed today. We will again continuously update those. There are, I think, 2 news literature pieces that Sara talked about that were not included in the first 3 resources because they just came out this week. So we will continuously update those as the science comes out and kind of update you. So the best way to keep updated is sign up for our newsletter where we distribute new information, or follow us on social media at Fitwel on Twitter, or follow us on LinkedIn. So we're right at 1:30. So I will thank you all for joining us and hope to hear from you soon.
Thank you.
Thank you.
Goodbye.